Welcome back to the BioNexus Health podcast. Now, this is for all age groups, but I get a lot of questions regarding dieoff. All right, so I already have, I think, about 4 videos on dieoff. There is one extended version that's just myself speaking about the mechanism and the science behind dieoff reactions or Herxheimer reactions. And then there are part 1, 2, and 3, where I did a Q&A session with many patients and families, parents that had questions about dieoff. But there's a couple other things I wanted to address, since my staff have been fielding a lot of questions about dieoff still, in spite of the videos. So let's talk a little bit about dieoff again.
Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a Ph.D. in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
2 important things to remember. When you send a question with symptoms that, there is increase in activity, etc., increase in hyperactivity in my child or your own self, right? That, I'm having increased joint pains, headaches, is this dieoff? The best person to answer that question is you yourself, because dieoff reactions are meant to be observed. They are a response to your treatment. Okay, so that is your responsibility for your child and for your own health to observe if you are experiencing any dieoff and which antimicrobial is causing the dieoff. Now, what did I say? Which antimicrobial? So if you haven't reached the antimicrobial section in your protocol, then it's highly unlikely that it's dieoff. Okay? So make sure that you are speaking of antimicrobials. That is the most important thing. Sometimes I have clients, patients only on the beginner's protocol. That's just nutrition, vitamins, minerals, what have you. And then I get a question, we get a question rather, my staff will come and ask, like, Jane is having, she's complaining of dieoff, and then we'll open the folder, we'll take the time and we'll see, and Jane is just on vitamins. So it's not possible to have a, to experience dieoff. All right, so first point, it is only with antimicrobials, the dieoff, Herxheimer. Please Google it and please educate yourself. Watch my videos so it gives you a good idea of what to expect, what dieoff response is. All right, coming to that, what is dieoff response? Dieoff response, just as the name suggests, dieoff, something is dying off. What is dying off? Your infections, your bacteria, viruses, parasites, mold, yeast, those are dying off. Okay, they are microbial infections. That is why you have antimicrobials in your protocol, correct? And that is why the antimicrobial section is the last section, so you can slowly build up and support your body before we add any antimicrobials. Dieoff response or Herxheimer, Jarisch Herxheimer reactions were discovered decades ago. So it is very common to experience dieoff with any kind of new treatment, not just herbals. It could be any kind of new treatment, okay? So as the bacteria die off, they release toxins. And these toxins, when there isn't enough binder or enough body support, right? All the items that support your body in the protocol that you've been given. If sometimes there isn't enough. So that's the reason why you see a die-off reaction. Now, is it the herbals causing the die-off? Of course not. The herbals are doing their job. So if you look upon it from that perspective, experiencing a die-off reaction is good news. It means that the herbs that you've been prescribed are bang on target. They're working, they're doing their job. So whose fault is it? It's no one's fault. It's not the herbals, it's not you, it's just the sheer amount of infection you may have. Okay, so the higher the level of bacteria, viruses, infections and microbes in your body, the higher the die-off. So for some people, they can easily build up to 5, 10, 15 drops 3 times a day. And some people start experiencing die-off at 1 drop, some experience it at 5, some don't experience it at all. So it completely depends on your body and your constitution, your infections, how many and how much of each you have in your body, right? The herbs are just doing their job. Now, each one of you in your protocol has strategies what to do for die-off. So please follow those strategies. It's a step-by-step. It very clearly says, it's even highlighted in yellow. It very clearly says that, if you cannot push through, if it's too much, if you're, feeling fatigued or tired. Now, again, these are not standard symptoms. The symptoms will differ from patient to patient. I'll come to that, but first. So you have been given step-by-step directions what to do. So please refer back to your protocol. You will see, right? Reduce, if you cannot push through, then reduce the herbals, and then, add in a binder, etc. So those instructions are highlighted in the antimicrobial section for you. You also have instructions on how to build up 1 drop at a time, little by little, okay? So it's your responsibility to add in 1 new antimicrobial at a time to see which one is causing a die-off, right? So you may have, antimicrobial number 1 that you're doing fine with, then you add in antimicrobial number 2, and, at about 5 drops, you start to see severe die-off response. Well, then what information do you get? That the infection that is being addressed by the first antimicrobial herbal isn't as high in your body as the infection that is being addressed by the second antimicrobial, correct? Because the second one, in the example I gave, is causing a larger die-off for you. So that means that infection is much higher than the one that is being addressed by the first herbal. So by all means, you can, slow down the addition of the drops of the second herbals. Just an example, right? So you have to problem solve. You have to understand what's happening in your body or your child's body. Many mothers dealing with a special needs child, they journal. So they keep that information for me for the follow-up. If it becomes completely impossible, then you can stop whatever herbal is causing a large, with whatever herbal you're seeing a large die-off. If you cannot figure this out, just stop, and then either you schedule a 15-minute appointment, or we can just discuss at the next appointment, right? Because we're not trying to rush things. We are trying to go little by little, so the body can gain momentum, the immune system gets stronger, and we can kill off the infections in your body. So there's no rush to it, because most of us, when we go into a herbal protocol, the infections are already chronic. They are inside the cells. We are experiencing biofilm as well. So it does take time. Please give yourself and your child adequate time. So there is no harm in that. Okay. Point number 2, the step-by-step directions on what to do when there is die-off, right? So one question everyone asks, how do I know it's die-off? And what are the symptoms of die-off? Is what I'm experiencing, I have headaches, is this die-off? So let's revisit that. Okay. So there are no standard symptoms of die-off. Die-off response will completely depend on your symptoms. So say, for example, you have tingling, numbness, you have pain in your ankles, you get headaches. Now, these are your current symptoms. You may have had some past symptoms that your weak immune system cannot demonstrate anymore. Okay. Now, some of the past symptoms and your current symptoms, yours as an individual, those are the symptoms you will see that they get heightened, they get worse for a few days. And you will experience this within an hour, maybe a couple hours of adding in a new antimicrobial. Okay, it's always the antimicrobials. So you have to keep track of your symptoms. All right, now one very important aspect. If you're going through a cough, cold, flu, virus, COVID, or if your child has been exposed to something in school, or if you have been exposed to another family member dealing with these, viruses, cough, cold, then understand that you might be experiencing a flare-up, not a die-off. Okay, you're like, I did not start any new antimicrobial. I am steady on my antimicrobials for a while now. So why are my symptoms getting worse? Think about it. Have you been exposed to something? Did you go to a restaurant where you were exposed to mold? Did you go to the grocery store, to the moist and wet section? Did you experience any mold over there? Was anybody sick anywhere you went? Shopping, grocery, school, home, relatives, grandparents? Did you visit grandma and go to the basement? Did you visit grandma in a moldy house? So there are so many things that could happen. So please understand that not everything is die-off. It's very important to differentiate whether you got a whole new infection that needs to be treated right away, or it is just die-off, right? If you can go back and correlate it to a new antimicrobial that you added, then you know that it's die-off. And the die-off response will usually subside when? What do you do when you're experiencing die-off? Follow the steps you've been given in your protocol. Okay. Best is to try to push through if it's not too much. You can increase the binder. Why are we increasing the binder? That's because, what did I say happens in die-off? That's correct. I said that there is a lot of bacteria dying off, and when bacteria, viruses, microbes, they die, they release all of their toxins within. And if by chance the dosage of your binder is not enough, then you just have to add in an additional dose, right? Add an extra dose of your binder anytime. As soon as you experience die-off, just take the binder. Take your Epsom salt bath. Take your lemon water. So there are some suggestions, right? Alka-Seltzer Gold is something that I've given you in your protocols. So there are several options that can be done before you decide, oh my God, this is too much, I can't go on. Because it's important to try and push through if you can. Now, it is also important to not push through if your body is sensitive and you're not able to, you're not able to function, you're non-functional. You have to send the kids to school, you need to get to work, or, it could be any number of tasks that need to be done. You cannot afford to take a couple days off or take it easy for a couple days. So it's entirely okay to reduce the dosage and stay on the lower dose until we meet again. All right. So I think that explains dieoff pretty well. If you ever need to schedule a brief, like 15-minute meeting with me, if you're still confused, by all means, my staff usually tries to accommodate you within a couple days. And if not, we try on the same day for the brief appointments. All right. So I hope this was helpful. It's very important to understand what is dieoff. Do not panic. Don't get anxious unless anxiety is one of your dieoff symptoms. It takes 2 to 3 days for things to go back to normal, but the improvements keep rising. You know why? Because you've killed off the infections. You've killed off, you've addressed the root cause of your chronic issues. So of course you are going to see benefit. So just do the best you can. It's, the same old thing I like to say, that it's not a sprint, it's a marathon. It takes time. Please be patient. Don't get too aggressive. But if you are able to push through, then that's okay as well. All right, good. So I hope that was helpful. I have to run. I have a patient. I was in between patients today, so I thought I would record this for you. So thank you for listening. I'm glad you're here. Don't forget to subscribe and keep smiling. I'll see you soon. Namaste.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.